The common symptoms and signs of cancer every one of us should know. Most of the times you start from the oral cavity, right from the oral cavity to the anal canal. If you look at most of the times what you have small ulcers coming up in the mouth, maybe on the tongue or maybe on the cheek, inner side of the cheek or under surface of the lips. So these sort of ulcers, if the ulcer is growing in size and which is not healing in a week or 2 weeks time, you should certainly show it to a doctor. These ulcers usually happen because of the teeth, direction of the teeth, either inside or outside, hurting it, like it might hurt the tongue or it might hurt the cheek, and you start developing an ulcer slowly. These traumatic ulcer, what we call, slowly would lead into malignancies. Similarly, there can be some sort of a white patches developing within the mouth. These what we call it as a leukoplakia, and these can be precancerous conditions or precancerous lesions. These leukoplakia are some sort of a reddening happening within the oral cavity. So these are also called as erythroplakic leukoplakia. So these are the early signs and symptoms of cancer happening within the oral cavity. So these lesions you need to show them to the doctor, or what the doctor does at that point of time would take a history from you that what are the agents you are already using, like for example pan parag or these sort of the things you might be requested to stop those things, and these can go back to normal mucosa. That means without developing a cancer they can revert back to the normal mucosa. So in the oral cavity you need to look at these ulcers or growths happening around the tongue or inside of the cheek. Then coming to the throat, most common symptom what we find is hoarseness of voice. That means a normal voice becoming hoarse commonly can happen with a common cold. But if this hoarseness of voice persists beyond a week or two, once the cold goes off, or a normal person without a cold, if this hoarseness of voice persists, you need to definitely consult a doctor. This could be an early sign and a symptom of a throat cancer or a lung cancer causing pressure on the nerves. So the other problem what we normally look for is while swallowing you might have difficulty in swallowing solid food. So if this happens, this could be an early sign and symptom of a throat cancer or a esophageal cancer, which is otherwise called as a food pipe cancer. So whenever a person is having a problem of swallowing and he needs to take a glass or half a glass of water for every solid food he takes, he should certainly see the doctor. We need to do an examination, an endoscopy, to see if there is anything, a tumor or growth causing obstruction while you are swallowing. Apart from that, if you go to the lungs, common problem what you see is a cough. Now common cough, you normally have a person having a cold or a pneumonia can also have cough. But if this cough is not going with a routine treatment of a physician with an antibiotics for a week or two, you should certainly see the doctor. So seeing a doctor and getting a plain chest x-ray, most often we would be able to see whether you have a problem, major problem like cancer. So you should certainly see a doctor if you have a cough which is not going within 2 weeks or 3 weeks time. Then coming to the abdomen, most often majority of the patients, if you see cross section of the society, most of them would have some vague complaints of acidity or flatulence or distension of the abdomen. If these things are persistently happening for more than 2 to 3 weeks, it is important that you should get some minimal investigations like an endoscopy or a colonoscopy. A tube passed through the mouth, we call it as an endoscopy, to see the upper part of the intestine, and a tube passed through the anal canal to look at the large intestines, or the larger part of the intestines coming from below. So if you do these minimal investigations and also an ultrasound of the abdomen which covers the major organs in the abdomen, if there is something going wrong, we can diagnose early cancer in the abdomen as well. And patients have some problem like passing blood in the stools. This is a very common symptom. We should take it with a pinch of salt. We definitely need to investigate such patients. It could be a simple hemorrhoids or piles, what we commonly call, but a pile also can cause bleeding while passing stools, and also a cancer can cause the similar problem. So we need to investigate by doing a simple examination by a doctor or a colonoscopy, which would differentiate between a standard or a regular pile from a cancer of the rectum or anal canal. So this is a common symptom which we should certainly address to.